Summer is a wonderful time to enjoy nature in your own backyard, tending to gardens and flower beds. But being one with nature can bring some unexpected consequences. Bug bites, bee stings, poison ivy. Joining me with answers for those red rashes and all that itching, allergist Dr. Summit Shah with Premier Allergy. Welcome, Dr. Shah. Nice to have you here.
Thanks, Gail.
This is a little close to home, as I was telling you earlier, because my husband, working in the garden, came down with the worst case of poison oak or ivy, whatever it was, and we really weren't sure what to do, and it lingered for a long time. What are the first things you should do?
Well, the first thing to know is when you have an allergic reaction to poison ivy or poison oak, it's actually an oil that's emitted by these plants. It's called urushiol. And so the first thing to do, in addition to controlling your symptoms, is make sure that you can minimize your exposure to that, because that oil stays around for a long time. So one of the first things that we tell patients is make sure they can try to wash themselves, wash their sheets, wash their clothing. And that's one of the reasons why oftentimes patients complain of continued exposure or continued symptoms. So, you know.
Well, because it has an oil base, then, is it contagious?
It can
I thought
be
it
contagious.
was.
Yeah, it can be contagious. For example, if there's a towel or something that, a patient's using while they're gardening and someone else picks it up, a pet oftentimes that runs off into the woods and is in poison ivy and poison oak and comes back to the family and everyone's playing with it, can certainly spread pretty quickly.
So washing and keeping everything clean is important. Then how's the treatment go?
Well, the treatment oftentimes is very symptomatic. We often recommend lotions, Sarna lotions, calamine lotions, antihistamines to control the itch. If it starts getting worse and starts spreading to certain areas, such as your face or your private areas, those are times when you probably should consult with a physician to see if you would be a candidate for more aggressive therapy, such as a cortisone shot or steroid pills.
Now, is everyone allergic to these plants, or is it just some people react more when they come in contact with them?
That's exactly right. Most people do have some degree of allergic reactions, especially to poison ivy and poison oak, because that urushiol oil is so highly allergenic. However, some people are immune to it, and they can walk in it and play in it and be perfectly fine.
That's so funny.
But yeah, there is usually a grade of severity for each patient.
And talking about bug bites and bee stings, I know there can be some really severe allergic reactions to bee stings, but how do you even know until you get stung?
Well, that's the case. Most reactions to bee stings, whether it's yellow jackets, wasps, honeybees, mixed vespids, can be handled at home. About 80 to 90% of them, symptomatic control. You get a bit of localized swelling, pain. You can take, an antihistamine. But sometimes the reactions get a lot worse, and they can be significant and systemic. And that's when you really have to be careful and make sure you have the proper treatment for that.
And you, in fact, brought an EpiPen, because for some folks it really does get so bad that they have a peanut reaction type of thing where they can't breathe and they get all swollen. And
correct. So an EpiPen actually administers a life-saving medicine called epinephrine. If you do have an allergic reaction, and signs and symptoms of that can be shortness of breath, wheezing, chest tightness,
serious stuff,
full body hives, that's the time when you should talk to your doctor and make sure that you have an EpiPen. The way you administer an EpiPen is pretty straightforward, and it's easy to keep in your wallet or your purse, is that you take the back end off, and then you go ahead and take an area of a thick muscle and, kind of stab yourself, if you will, or inject it into your leg. It's not a fun process, but it can be life-saving if you're having an allergic reaction.
And for folks like that, they've developed this over time, like they had a bee sting and they'll notice if they've gotten more, their allergic reaction has gotten worse.
Correct. You can't be allergic to something the first time you see it. So the first time you're stung, whether it's to a bee or a mixed vespid or a hornet, you can't be allergic to it. But over time, certainly you can develop an allergy to it.
This is a great topic, Doctor, and I know that our viewers have questions for you. So we have our email address for viewers who want to write to us with a topic that they'd like you to discuss. And I know that there's so much that we can go into, and we always just hit the tip of the iceberg with some of these topics. So we appreciate you being here, and that address is info@premierallergyohio.com. It's on the screen, so we want you to give Dr. Shah some calls and email, and we'll get it on.
Sure.
All right. Thank you.
Thanks, Gail.